Senator Morton.
Thank you, and I'd like to thank Senator Burke for allowing me in, and I know that we're pressed for time because we started 20 minutes late. Minister, I too, and I know a lot of what I've wanted to say and I wanted to discuss has been raised, so I'm not even going to go there. It's been raised by my colleagues. And I would like, if I could, to concentrate yet again, and I know it's an area that you know that I have a huge interest in, is in the mental health of children with a disability. And I've been requesting this debate for several times, and you know that since I've come into the House, I don't think there's been a mental health debate where I haven't raised this topic. And I know that last year, in March actually of last year, I raised an issue that was actually at a crisis point. Where a family were refused by CAMHS, refused by paediatric services, and when they visited their GP, the only option given was sedation. At the same time, there was no child psychiatrist for the Louth Meath. As of today, we still do not have a child psychiatrist. The recruitment process is ongoing. And it's something that I've raised with you, I've raised with members of the staff, and it's still going on. And I went to the Director of Mental Health Services, and again I'm told it's recruitment, which other people have brought up today as well. It's a case of recruitment. But Minister, what I'd like to say is, you know, where do these children go between the 16 and 18 age bracket when there is no local child psychiatrist? They don't fall under the CAMHS remit or the paediatric services, and I've raised this before. Where do they go? And I would just like to say that a year later, almost over a year later, we're back here and I'm still asking the same questions. So, Minister, what I'd like to ask you today, can I ask you that the funding that is there for the child psychiatrist, you know, I've been told that there is one there. Could I ask that if the child psychiatrist is not in place now, which it isn't, can the funding be allocated to the parents who have paid over €700 in a lot of cases for private assessments? You know, would that be possible to put it in? And also, just from speaking to you know, different recruitment agencies, different services that are out there, and I would like to welcome members of ServiceSource that are here today, that provide an excellent you know, alternative and recruitment facilities, and they report, as do Bluebird and other agencies as well, that they do have the staff there. So can we access that a little bit better, or can we engage more with them and listen to their models so that we can improve the situation? Others have raised the issue of children and adult units. Again, 89 admitted last year. I know in my maiden speech here in the Seanad 4 years ago, it was something that I felt very, very extremely you know, vocal about and very strong. I felt very strongly about it, and again I'd say, you know, 4 years on, I recognise, and I do, Minister, appreciate the work that you know that you are doing, but again I think it's another huge area that we need to look at. The waiting lists, and again it's something we talk about, the waiting lists. 400 people on a waiting list for mental health services are 400 too many, I think. We're looking at people who are extremely vulnerable, and we're also looking at, as a result, families that are extremely vulnerable, people that are on a waiting list for more than a year. And you know, it's just not acceptable. As a matter of fact, I spoke with somebody yesterday who was on a waiting list for a year and a half, where the only option they were being given was sedation or wait, or you know, see, and that family have lived really in trepidation, waiting for an appointment to try and get something, which they're being told 18 months down the line. It affects the whole family. I just really would just like to raise, when we talk about the children's mental health, if we could talk about the adults' mental health, and it's something that I would feel it needs to lead on into it, and it's about the local service. And again, I apologise for, I don't apologise for making it local, but in my own area, Drumcar, a respite facility for children with an intellectual and adults with an intellectual disability, last week closed its doors to facilitate training for the next 6 weeks. Now, I believe that there's a HICWA inspection going on. Minister, I just feel that something that's providing the only respite to families that are out there, that it's absolutely unacceptable that they can decide we're closing for 6 weeks to facilitate this, and give parents and family members a couple of days notice that they're closing for up to 6 weeks. So, Minister, I would really, really ask that today that you look into this matter as a matter of priority, with John O'God's, with the funders, HSE, and see, is there an alternative given? Because I don't think it's acceptable in this day and age that we can deny the most vulnerable people and their families respite care. Thank you.
And Tara.